Good morning. This is Missy McKenna. I'm with the skin team,
And I'm Colleen Maurer. I'm also on Skin Team.
so we are going to talk to you today a little bit about our Immerse bed. That is a specialty surface, about how to use it, about indications for it, how to set it up, the safety features on it, and just general purpose utilization of the surface. As a reference, if you don't remember everything we're saying today, on your med carts at the nurse's station, there is this nice little troubleshooting, I guess that's it, to start with. It says must knows for the Immerse bed, and this will help you on setting things up, knowing which modes to set it in to get patients in and out of bed and such. So this is a resource that you have all the time at the nurse's station. So this is the Immerse bed. This is our skin surface, our specialty rental skin surface. So first let's talk about what indications there are to use this bed. Our beds that we have in-house are therapeutic and prophylactic stage 1 to stage 4 pressure injuries. So we do not need to bump up to this bed instantly if a patient comes in with a pressure injury, okay? Some of our indications are if they come in and they have pressure injuries or wounds on multiple planes. So if they have a unstageable stage 3, stage 4 deep tissue type injury on a hip and a coccyx, or on heels and hip, something that you can't effectively offload, it is evidence-based at that point to bump them up to a higher level surface than what we have in-house. So with that, we would order the Immerse bed for those patients. Also, there are specifics cutouts in ICU for specific patients on so many vasopressors and CRRT, things like that. Patients that are immobile because of balloon pumps, hypothermia protocol, we try to get those patients on these surfaces as well. So, any other clinical indication you can think of I missed there? So the other is on a case-by-case basis. Sometimes because of acuity and things, we will bump them up to this surface, but that's a decision that's usually made between skin team and myself and some of the physicians. So. This is the Immerse bed. So when you first get it, there's 2 plugs that plug into the wall. The other thing that we want to make sure that we do is there is a cord at the end that plugs into the call light system. This is what is going to allow the bed alarms and all those things to go through the responder 5.
Correct.
So that it'll come to your voice errors and things like that, and you'll know when that bed alarm's going off, because you can't always hear it. We all know it from the nurse's station or wherever you are if it's just going off in the room. So we want to make sure that we have that plugged in. The other thing that I want to touch on that's very, very important before I forget is this bed, and honestly all of the rental surfaces that we bring in special, they are all some type of pressure redistribution surface as far as with a low air loss function. So 4 rails up is not considered a restraint on these surfaces. This is a safety feature. There is a carve out in the restraint requirements for these types of beds. So we always want to have 4 rails up on these surfaces when we have a patient on the bed, okay? It is safety, it's not considered a restraint. The other thing that keeps the patient safe when they're on this bed, are we plugged in?
Yeah, we just need to turn on.
When we turn it on, once you've plugged it in and hooked it to the wall, on the side there's a power button. We want to turn the power button on and the bed will inflate. So to adjust the firmness of the bed, so if we are putting a patient on the surface for the first time, or we're getting them up to get them in the chair, we want to make sure, or we're going to dangle them on the side of the bed, we want to make sure that it's firmed all the way. So there's a lockout button to get this bed to work. You have to hold that lockout button until it beeps. It was like 5 seconds. Oh, it was unlocked and I just locked it. Once it beeps, you can adjust here, okay? So if you're getting a patient up, or you're just putting them in the bed for the first time, you want it firmed up all the way. So that way, at that point, I guess I should lower it. Colleen, will you sit on the side and show them, put the rail down, that this bed, when it's firmed all the way, is as firm as a regular mattress. You're not going to fall out, okay? So you can make those adjustments. If you are just repositioning the patient, pulling them up, things like that, you can auto firm. There's an auto firm feature that's wonderful, and it will firm the mattress all the way for 10 minutes. And after 10 minutes, it will put it back into the immersion mode. If you dangle them on the side of the bed, or you're working on getting them up and you don't have the chair and everything set up, or you get distracted, if you're in that auto firm mode, that is a fall risk getting them up, because the bed after 10 minutes is going to go back into the immersion mode. Now it's going to alarm 3 times. It's going to have like 3 bells that beep at you to let you know that it's getting ready to immerse again. But for safety sake, if we're getting them out of the bed, we want to make sure that we have manually firmed the bed all the way up, okay? Now when they're just in the bed, when we're using it as a pressure redistribution surface, we actually want this only on 1 to 2 bars. Honestly, 1 is best. If they're over 250, then maybe bump it up to 2 bars, but that's all we need. This bed moves a lot of air through it every minute, and it's not going to let them bottom out, okay? So, like I said, the same way to change it. If you're coming in and they're on this, you have to hold the lockout button until it beeps about 5 seconds, and then you can hit the auto firm and it will firm the bed up. You always want to make sure that you're doing that for you and the patient's sake, if you're moving them or repositioning them. Otherwise, it's like you're trying to drag them out of a hole, because that bed is immersing them as much as possible in it. As far as we talked about linens on the beds, the specialty surface, because it's an immersion surface, should not have a fitted sheet on it. That actually decreases the mattress's ability to immerse and move with the patient. So we want a flat sheet over the mattress first, and then absolutely on this surface, because we've already identified that this patient's at a higher level of risk, that we've moved them off of our standard surfaces, they should always have a glide sheet underneath them as well. Glide sheet, just to reinforce again, it goes long ways on the bed. The colored side, the pretty colored side, whether it be blue or green or what have you, that always goes down. The gray side on all the glide sheets that we utilize, the gray side is up against, is what is against the patient. 1 pad, if they are incontinent or have issues, 1 pad long ways underneath them. Please do not double up on the pads. Multiple pads actually decrease the effectiveness of the surface and actually put your patient at greater risk for skin breakdown, be it shearing, friction injuries, heat-related injuries, or pressure injuries. So 1 flat sheet, the glide sheet, and an incontinence pad if it is needed is what we want on those surfaces, okay? The other thing, as far as the safety-wise, because we discussed 4 rails being up is not a restraint, it's a safety feature. The other thing that's an important safety feature is actually utilizing the immersion therapy like it's designed to be used. We only want this, again, at 1 to 2 bars. When it's at 1 to 2 bars, what happens is it looks like they could just go right over the top of these rails because the mattress is so full with it just sitting here. But if a patient is on it and they roll towards the rail, what happens is the immersion surface redistributes the air and drops the patient down in against these rails, so it doesn't allow them to go over the top. So if we're not using the immersion feature appropriately and we have the bed very firm, what will happen when they roll this way is they will roll right over the rails because the bed can't work like it's supposed to and actually drop them down in to protect them, okay? So 4 rails up, making sure we have them immersed well in bed. If we're turning, repositioning, pulling them up, we want to hold for 5 seconds. We want to auto firm because that will hold for 10 minutes. When it's auto firm, then we want to reposition them. That's safety for you as well as the patient. Okay? If we're dangling at the side of the bed or we're getting them up, it needs to be manually firmed. At that point, it's safe for them to sit at the side of the bed or be moved to the chair or ambulate or what have you. We never want to auto firm it to get them out of the bed because after 10 minutes, it's going to go back into the immersion setting, and that puts us at greater risk for falls.
So another important point when setting up the immersion bed is to make sure that you are accurately getting a correct weight on the patient for I&O. To do this, you just zero the bed just like our others. There's a zero button on this in-bed control. You hold it in for 5 to 10 seconds, and then it will say that it's zeroing the bed, and just like your normal beds, don't touch the bed while it's doing this. And then after that, on your main screen, the weight will be on the screen at all times. Just be cautious if you add anything to the bed, such as STDs or anything like that. The next part that's important on setup is knowing how to function the bed exit alarm. So on the top part of this, it's a label that says bed exit alarm. You have to hold it down, and it will highlight on the bed and go to the next one. You want it on low sensitivity, which is the same on your regular beds as zone 1, and this will allow some movement in the bed without too much movement. If you notice that you feel like your alarm's not going off, then you can go. And the sound you hear is the bed exit alarm going off. To remove the bed exit alarm off of the system, you just hold it in, and that will allow it to reset. And then you need to make sure that you reset it again. If there is no light above the sensitivity setting, then your alarm is not on. Function, but it should go through as long as you plugged it into the wall, your RL5 system, and go straight to your Vocera. The only last safety feature I can think about on this bed is if your patient did indeed code and you would need to put them flat, you can indeed hit this press CPR for that. That's the only time we want to utilize this button on this bed, and then your cook team can come in. But that button is only for that. Anytime you get the patient up or change settings, you should be manually doing it on the side of the bed.
When you transfer, I've had questions about this. When you transfer patients to surgery or to another unit, the bed does not stay firmed. Once you unplug it, the air goes out of the mattress. They are not sitting on the bed frame. There is a foam mattress at the base of this to protect them, to make it safe for transport. So it is appropriate to transport them to and from surgery, to and from procedures, all of those things on this surface. Okay?
Thank you guys for listening to us today. If you have any more questions about